All right, welcome everybody. My name is Dr. Dennis Buckley. I practice in Pasadena, California. Been there for 20 years. Been involved with San Gabriel Valley Junior All-American football since 1997, coaching clinics and also doing pre-participation physicals. It's good to see a lot of familiar faces. You guys have been in this program a long time. I guess, but I say thank you on behalf of a lot of kids and a lot of people, because I really understand how much work you put into this, how much time it takes. I know because you get paid a lot of money to do this, right? Yeah. And you get all sorts of appreciation. You do get the appreciation, but you do have to put up with a lot. So one of the things we want to do here today is really help you empower your program to be in compliance. This is a football. Football is not a contact sport. Football is a collision sport. Dancing is a contact sport. Collisions happen. People do get injured. It's part of it. Of course, also, more kids are injured on scooters and skateboards than they are in organized football. Okay? So one of the things that accidents will happen, but you can prepare your teams, you can prepare your coaches to minimize the injuries, and if something does happen, you will be doing the right things to prepare them, to take care of them, so that you're not exposing yourself to liability. Because guess what? If something really bad does happen to a kid, and we hear about it out there, and it doesn't happen that often, thank God, but it's very dramatic, and it's very sensationalized in the media when this happens. And also now with the concussions in the NFL and all the long-term effects, it's really high on people's mindset. So parents who may have their kids and wonder if it's a good thing for them to be playing football, you know, you can assure them that you are adhering to the highest gold standards of what is currently available and what is also required by law. And if you understand that, you can limit your liability, because if something does go wrong, you still have to do the right things. And we're going to go over it today. Now, there's a lot of information here today. I'm going to get through it as efficiently as possible, highlight the areas you really need to know, and it might be a good thing later on, actually, maybe you in your league city may actually sit down and watch it independently or watch it together just to get the information. Hope everybody can see this here. I'm trying to get it inside the viewfinder here. 300 sports-related injuries and concussions happen every year. Okay? Brain injuries cause more deaths than other injuries in sports. 90% of boxers have sustained injuries. 50% of soccer players. Actually, there's a higher incidence of soccer. And I think in a lot of the lower divisions, they don't allow heading the ball. I'm not sure if that's true or not, but that's a lot of it when it comes to it, to the cumulative trauma. In football, concussions count for more. Football counts for more concussions than any other sport in North America. The actual frequency is controversial. Look at this. The incidence in a single football player is at a range of 3.6% to 47%. That's a huge range. So what it's saying there is probably underreported, it's unrecognized, but then you find out about it later on. 250,000 injuries per year, 10% of college and 20% of high school players suffer concussions. And football players with brain injury are 6 times more likely to sustain another injury. Okay? Now, here's where we get into the bread and butter here. Oops, can't do that here. Okay. Concussion can be caused by a direct blow to the head or somewhere else on the body. Okay? And that doesn't necessarily mean it involves another player. It can involve the ground, a structure like a goalpost, or a hit from behind that causes a rapid acceleration of the brain, like a whiplash. Okay? Loss of consciousness is not a key factor, but a significant factor. You can have a concussion without loss of consciousness. And individuals with concussion may present with a wide range of signs and symptoms. When I get into this later, there's kind of an interesting phenomenon, because the signs of concussions actually describe most of your players most of the time. Okay? So you have to understand what their baseline is, what their level of function. Like I said, an athlete suspected, not confirmed, suspected of concussion must be removed from play immediately. They must not be allowed to return to play unless they have clearance. Okay, and they're not allowed to play the same day. If you suspect something that day, they're done for the day. Okay, and then any individual with signs or symptoms of concussions at rest or with exertion should not be allowed to participate until the signs and symptoms resolve. What that means is if they have a release from the doctor, and they come back and said he's clear to play, and he starts doing his practice, and all of a sudden he starts exhibiting signs and symptoms, just because he has a release from the doctor doesn't mean that he is clear, he's fine. He's not fine. You must recognize that, remove him from play, or her, if she's playing, or if it's a cheerleader, and remove them from participation, and they must go back to the doctor if you suspect that they're not functioning right. Also, consultation with a qualified healthcare provider. This includes a medical doctor, a chiropractor, an osteopath. Those are the three. It's essential after suspected concussion. So if you suspect it, you need to send them off and explain to the parents they must be checked and must come back with clearance. That is actually the golden ticket, that they went and got care. Here's the problem though. Many parents will, okay, I'll take him. And then they don't. Then they'll come back and say, oh, he's fine. Well, did you take him to the doctor? Well, no, but he's fine. No, I need a release. Now, parents may get very upset about that because of, one, money. That's what it comes down to. It's usually money. They cared about their kids, and money's no, I'm sure they do care about it, but that's the number one concern, is money. But I'm sorry, if you suspect they have a concussion, very simply, they don't play unless they have a release from a medical doctor, a chiropractor, or an osteopath, somebody licensed to do that. Okay? Individuals with concussion should be directly observed. And the serial examinations are not to be left alone after injury until the constellation of symptoms are static. What that means is you're going to know if they're right or not by the way they act, the way they play. If they start complaining of a headache, if they're tired or whatever, there's going to be certain things. Now, we're not going to make you all doctors or hold you to the same responsibility, but you know if they're not performing right, if something's not right. And it's also very good to be talking to the parents about their activities before practice. Now I'm going to give you a nice little way later on about how you can sequentially introduce them back into play, and it's the gold standard, and it makes sense and it's pretty easy. Okay, clearance by qualified healthcare provider. They must be symptom-free at rest and with exercise return to play. That means that they must be symptom-free in their normal activities, and then when they start practicing, they must also be symptom-free before they're allowed to return. Now here's the thing. Younger athletes, high school and lower, have been shown to exhibit longer recovery times compared to college and adults. So it's much more significant with kids because, one, their brains are still developing, there's still plasticity, there's still a growth pattern going on there, and an injury, a concussion, can actually interfere with not only their physical abilities but their mental capacities. The key thing here is the second impact symptom. This is what happens. The kid gets dinged. We've all seen it. They're like, ugh. And then within about 5 minutes, they're fine, ready to go. Okay? It's that second impact that does the damage. And sometimes the second impact can come the next week after an injury, like we have a concussion or a suspected concussion. So it's clear that adolescents must be protected from this potential catastrophic event because it can be catastrophic. Like I'm saying, it doesn't happen that often, but when it does, it's quite significant. And all of a sudden there's attorneys involved, everybody in the zip code is going to be being sued, you're going to be sued personally, the league's going to be sued, because that's how the lawyers act. They start suing everybody, and everybody has to prove that they were compliant. And if something does bad happen, go on, a lot of times it doesn't mean you're negligent. You were doing your job, you did the right thing. That's why it's good to have some type of risk management program. If this does happen, what happens? If someone's suspected of a concussion, what happens? Do you have phones? Do you call the ambulance? How do you secure that the parents actually took the child to the hospital to be checked out? Also, they're saying that gene may exist that cause some individuals to be more susceptible to concussion. Controversial, but it may be some people are just more susceptible, just like some people are more susceptible to heart disease because of family history. Many concussed individuals may not be able to concentrate. They may not be able to read or absorb material, may develop an increased headache while doing so. This is one of the key signs is the kids will complain after the concussion they're released. They go to school and they start doing work at school and they'll complain of headaches from that. That means they are not ready to get back. They still have to heal up. If just reading causes it, just imagine what being hit out on a football field will cause. They may be, for this happen, they may be able to participate in an activity for a few minutes. So that sometimes they may have to build up their increased tolerance to headaches or symptoms such as nauseousness or dizziness. But if that gets to that point, basically you need to say, no, you need to be symptom-free and be able to participate symptom-free. You don't want to take a chance on this at all. Said as the symptoms abate, go away, longer intervals can be taken. School is the thing. Some kids might have trouble going to school because of concentration issues at school. So that's something that needs to be monitored to the parents in the school. You must, tell the parents, they must notify the school that this child has sustained a concussion or suspected concussion and that they need to be monitored while in school. Like I said, concussion may be caused by a direct blow to the head, face, neck, or somewhere else in the body with an impulse force transmitted to the head. Usually most concussions are rapid in onset, short-lived, and they go away pretty fast. It's that, that, and then they're fine after that. But that sometimes is a sign that you really need to look at them. The problem is most of the time, like I said, a lot of high school games, unless somebody is really knocked out, what we had a lot of times is one of the kids will say, get him off the field. He doesn't know what he's doing. And you watch them on the film, and they're out there. They're playing football game. They have no idea what's going on. They're out there going on sheer instinct. They're running around, and that's scary because that's the person that's susceptible for the second impact. They may be injured. It says concussion may result in neuropathological changes. That means brain damage. But it shows up as functional stuff, like they're dizzy, they can't walk, they can't talk, they're having trouble moving, they feel tired, lethargic. So the damage shows up physically outside. Like I said, concussion may result in symptoms that may not result in loss of consciousness. That is a key thing. Just understand this. If there is a loss of consciousness, even for a second, or suspected loss of consciousness, on practice or at the game, that is the need for an immediate transportation by ambulance to the hospital. No questions asked. Now, what if the ambulance shows up, you do your job, and the parents say, I don't want him to go? You explain to the paramedics, loss of consciousness, injury, we want him transport, and the parents say no. What happens is the ambulance company will then have them sign a release saying that they are denying the transport. You are now protected to a point because you did the right thing. It's the parents that now took the responsibility. Now, if something goes bad after that, they're still probably going to sue everybody. But guess what? You say, hey, we did this, we followed our protocol. Here's our protocol we did. They signed out there. There's something. It's terrible though, because basically you really need to express ahead of time. Let them know, the parents ahead of time know in your meetings that if there is a suspected concussion with any loss of consciousness, because loss of consciousness could actually be they're just kind of out of it, but they're not responding to any stimulus, and all of a sudden they pop out of it even with their eyes open. That's a loss of consciousness because they're not there. Okay. Now you may say a lot of my kids are that way most of the time. So I'm saying know the baseline. Okay. Okay. Well, so how do you define a concussion? Well, over the past 20 years, it's pretty much been in transition, the definition. But it is an immediate and transient loss of neuronal function. Okay, what does that mean? That means they're not acting normal the way they were before, and it's showing up in signs and symptoms. Okay, and the neuronal function includes LOC, which is loss of consciousness. That's what you'll see a lot of times. Memory problems and motor skills. So they can't remember who they are, where they're at, what game's playing, what the score is, what their name is. They can't focus on things. They're having trouble walking or moving, and they feel sick. Those are all signs of a concussion. So here's the key one. This is very, very important, especially when pre-participation physicals. When you're assessing your players, you as ADs and coaches need to know what kids have had previous concussions. You need to know what kids are diabetic, what kids are on medication, especially the attention deficit or asthma medication. You need to know what kids have learning, behavioral problems, disorders. And you also need to know if they've had previous fractures or some type of injury, or if there's something very, very evident in their medical history to find out. Most times, I'll say a lot of the ADs find out afterwards. Well, here's my inhaler. You have asthma? You know, like this. So make sure you know that. But basically, the question is, have you ever had one before? Meaning, have you ever had a concussion before? The question should be, have you ever had any signs and symptoms after being hit in any sport at any time, such as dizziness. Did you ever get knocked out? Have you ever got nauseous? Did you ever have to go to the doctor because of a head injury? Those are the questions that basically raise the red flags. You want to know if they've had previous concussion. Because the thing is, if you've had a previous concussion, you're much more susceptible to having a second, third, or fourth one. Okay? Like I said before the brain is completely healed, it's very susceptible to injury. And the second injury can lead to that second impact syndrome. Like I said, it's 2 to 6 times more great to have it if you have one before. It can cause a fatal brain injury. It can be associated with concussion. An athlete may be presented with a seemingly mild concussion. However, the clinical picture could change drastically. We had a kid over at Cantwell when I was team doctor over there, and he was out there and he came off the field. He was just shaking his head. He goes, well, I got lit up. We go, okay. So we started looking at him. He was just kind of going, he kept shaking his head. And one of this, at nighttime, one of the telltale signs is the high sensitivity to light. They have an ongoing concussion. They can't open their eyes. They'll be like this the whole time. So that's very important that a lot of times, I don't think they allow the masks with the face guards that are darkened. No. You want to be able the referee wants to be able to see those eyes. The thing was, he was sitting there and he was like, I go, okay, you got to be transported. Well, his dad was a coach. His mom was right there. We brought it down and so he said, can you take him over to the emergency room? So he got dinged up, got a concussion. And he's sitting there and he goes, okay. So he's walking, and she'll walk him to the parking lot. He gets halfway to the parking lot and he just keels over. So now we have to call the ambulance to take him over there because, he was dinged, but all of a sudden the clinical picture changed. And that can happen. And remember, with little kids, it can happen quite drastically. Okay? Like I said, an athlete appears stunned with even without losing consciousness, gets up on his own power, and collapses soon thereafter. Some of the things that you'll see is a lot of the concussion shows up in the eyes. You look in their eyes will be all buzzing around. They'll be going left to right. They can't open it up. They're hypersensitivity. If you ever see that, 911 right away, because it is an ongoing concussion and it could be actually increasing. Because what happens is with the injury, there could be swelling starting in the brain, and this is how it's showing up. This is the tip of the iceberg. Luckily, most of these things calm down after about 5-10 minutes, and the kids say, okay, I feel fine, I'm okay. No, they still got to evaluate it, because guess what? It could be just a transitory period where it could be actually developing a problem. Also, here's the big thing. If you ever suspect a concussion, suspect a cervical injury or a neck injury. If you ever have a neck injury, suspect a concussion. They seem to go hand in hand. Okay? There's 2 types of memory loss. There's retrograde amnesia and anterograde. Retrograde is basically they can't things that happen in the game. Like whatever happened. Like, what happened during the game? I don't know. Because a lot of times when you get them a concussion, there's been 3 or 4 plays that have gone on. They don't remember what happened. Okay? There's anterograde. This is basically to form new memory. So if you ask them a question like, remember these numbers, 5, 11, and 18. They go, okay, 5, 11, 18. Then 5 minutes later, you go, what were the numbers? They can't remember it. That's an amnesia. That means that things aren't processing immediate transportation. Children should not be returned to practice or play until clinically completely symptom-free, which will require a longer time frame than adults. A longer time frame than adults. That's the key. And this is an issue I get all the time. I get a phone call. The doctor says, he's fine, he's doing, can you play this Saturday? I go, what did the doctor say? Doctor, you saw, says he's out for 2 weeks. I go, he's out for 2 weeks. Come on, he's fine. It's a big game. Come on, it's a championship like this. And I said, listen, this is one game. It's in the grand scheme of life, it's not going to have that big of a deal. But if you make the wrong decision, it can be quite significant for the rest of your life. Err on the side of being conservative until everything you are confident that they are fine. Okay? One of the things that kind of basically, it's kind of interesting if there's a good use of video games. Kids that have concussions that aren't good, they start playing video games, they put them down because it's too much stimulus and it overstimulates their brain and it gives them a headache. Like I said, the damage to the brain can be catastrophic. Almost all reported cases of second impact syndrome are in young athletes. Okay, under 18 years should be managed better. Now, MTBI means mild traumatic brain injury. okay, as opposed to a severe. Severe would be somebody's knocked out for more than a minute, somebody's got a skull fracture, someone's got a broken neck along with concussion. This is mild traumatic brain injury, and basically it's appropriate to extend the amount of time until asymptomatic. It's inappropriate to return that same day. If you suspect somebody has a concussion that day, do not put them back in the game. They're done. That will save you a lot of problems. And in the heat of battle, people start making decisions that are probably not in the best interest. A concussion history is important, but not many athletes want to recognize all the concussions they have suffered. A lot of time, I was the other day, I was up in Northern California, and these two gentlemen were talking, and I was playing golf, and they said they were for baseball, and they go, hey, they want us to go to this concussion seminar. And the guy goes, yeah? Well, really? For baseball? And he goes, yeah. He goes, they want us all to have, he goes, I know about concussions. I've had 5 of them. The friend goes, well, that explains a lot. Okay, so basically the history is important. Pre-identify athletes can fit into a high-risk category, meaning they've had a previous one before. Some players are more susceptible in high school and college and pros to getting concussions. Linemen tend to have multiple cumulative trauma. People on special teams, receivers, seem to have the more one-time event that is more catastrophic. As you see, a receiver over the middle gets teed up by some defensive back. That's bad. The linemen in the trenches, more accumulative trauma. Running backs are more accumulative trauma. So you basically have to understand what position they play and what happens. So like on the kickoff, the little kids that are running around, but as they get older, the hits start getting bigger. And there's usually a couple kids that are much more dominant in the hitting scheme than the other people. And you have guys out there who are scared and they get hit. That's going to be a problem. So basically, pre-identified athletes, and this provides you an opportunity for the team coaches, AD and Link, and healthcare providers to educate the athletes and the parents about concussions. Previous symptoms of a concussion, not if they've had a concussion or more. Have they ever had symptoms of a concussion? It's also worth noting that dependence upon the recall of concussive injury by teammates or coaches may be unreliable. They're fine. He toughed it out. Okay, that's what did he tough out? Well, he was pretty beaten up. So, what are the warning signs to seek immediate help? Here's what gets down to the bread and butter. Inability to waken the athlete or get them out of their state. They're knocked out, basically, this is serious. Severe worsening headaches after the injury. Confusion. Restlessness, unsteadiness, or seizures. Call immediately. Difficulties with vision, like I told you, that's probably the one thing that most kids will complain about. They may also feel nauseous and a headache. Stiff neck. Urinary bowel incontinence, that's usually not shows up, but if it gets to that, all those other ones are usually going on too. Weakness or numbness involving any part of the body. They may expect somatic, means body affective or cognitive symptoms that gradually taper in severity of days, months. So basically their memory, how they feel, the pain, headaches and stuff will taper over days. They may result from brain injury or trauma involved in head or neck also, because that's what I'm saying is if someone goes for a concussion, tell the doctor, could you please check their neck also. See, the most common symptoms are headache and dizziness. Also include blurred vision, neck pain, fatigue, problems sleeping, emotional or cognitive disturbances, ringing in the ears, that's tinnitus, problems with balance or coordination, loss of hearing and smell, loss of consciousness on the field. This is date of injury referral. Basically, this says, this is like, if this happened, you got to send them to the doctor that day, preferably by ambulance. Loss of consciousness, any loss of consciousness. Loss of memory lasting more than 15 minutes or even close to that. The little asterisks are immediate transportation. Actually, the first one should be touched too. Deterioration of neurological function. That means they can't walk, they can't hold their arms up, they can't see, they can't having problems. You see the levels of consciousness, they don't know where they're at. Hard to breathe. Pulse part, usually your medic or something like that on the sidelines. Hopefully that's what you'll have on the sidelines. A doctor or a medic or somebody on the sidelines that can monitor them while you do your job. But a lot of times in practice, it's you, right? You're the nurse, doctor, head waiter, bottle washer, you're everything. The pupils being the eyes are the really key one there. Does any bleeding? Anything open, like the guy in the Louisville, anything sticking out? That's immediate transport. Okay. I said any of the mental stages. These things are all the things that you must look at and manage. But I'm saying it's very simple. You don't have to sit there and say, well, they only have 3 out of 5. No, they have 1 of them. If some kid's after being hit, throwing up, you get him out of here. If he's having trouble seeing, he's got dizziness, he's out of here. Any suspected loss of consciousness where they're out of it, they feel tired, they have a headache, get them out of there immediately. You'll save yourself a lot of problems. These are just more of the same ones. Now, a lot of times kids will, you okay, and they'll play and everything's fine. But the next day, they'll have a headache. The next day, their parents will tell, he's been sick. He's having trouble sleeping, whatever. So basically, post-concussion symptoms begin to interfere with the athlete's daily activities. That requires, if that's the case, they're suspended from playing or practicing. They need to go see the doctor and get a note. So it is okay to use things like this. If they have a headache, you can use acetaminophen and Tylenol if they have a mild headache. You can have ice pack on their head and neck as needed. That's fine. They can eat. They can return to school. They can sleep. You don't need to wake them up every 2 hours and make sure they're okay. That doesn't work out. And they can rest, because basically they need to actually, at this point, they really do need to rest. They need everything calmed down. On the field of sideline evaluation, this is where it's going to possibly, most things are going to be taking place. So basically, your AD, your medic, or somebody should be doing this, but you really don't have to do this except just checking and seeing some of the basic things and asking them questions. The best way, you don't need to take off their helmet, especially this one thing. If the kid's on the field and he's suspected of concussion, do not take his helmet off. Because remember, suspected head injury, suspected neck injury. Everybody wants to take off their helmet and everything. Don't leave their helmet on. Because basically it supports their neck and their head. Also, that's why you watch where you're going to basically say their name, do they know where they're at. If they're not responding to that, they're moaning and stuff like that, that's one of the things is that you don't move them at all. You actually call the ambulance if you suspect they're out of it. Okay? That's the easiest one to do. If you suspect they have a consciousness, do not touch them, keep them there, monitor their symptoms, get your medic out there, get 911, get the ambulance, and get them transported. They'll save it. Because if you move them off the field, and it's not safe to do for, and there's a problem, that's where your liability comes in. Okay. Sideline evaluation, if there's any of these things, it's kind of what I said before. But basically have your medic or AD. Maybe have somebody there who's trained. Okay. Here's the key ones. Okay, if you suspect they should not be left alone on the sideline. They should be monitored every minute, asking, hey, do you know where you're at? Things are changing. Most of the time, they're fine. They're more interested in the game. I want to go back in. That's a good sign. But when they're on the sidelines, they're just staringly vacant and the game's going on, like that, that's not a good sign because that's not normal. Most kids want to know what's going on. And like they should not be allowed to play. There's grading systems. Say everybody wants to know what kind of concussion they have. There's 2 of them. There's the CAN2 guidelines and there's also the Academy of Neurology. You'll see the difference. The grade 1 is no loss of consciousness, and they have post-traumatic amnesia less than 30 minutes. And post-concussion symptoms in less than 24 hours. That's a grade 1 mild. Grade 2, any loss of consciousness and less than a minute. Grade 3 is more than a minute. Okay, that's the CAN2 guidelines. The next one is, grade 1 is pretty much the same. Grade 2 is transfusion, no loss of consciousness. So you can have a grade 2 without loss of consciousness. These are more strict. Doesn't matter to you. If there is a concern, get them checked. Get them transported, be on the safe side. Okay? Now, here's the thing. This is up in Washington. This is probably kind of stimulated what's going to go out the whole country. It's called the Zachary-Lightsit Law. All school coaches will have to take a training course on the nature and risk of concussion and head injuries, including continuing to play. Each school year prior to initiating either turnout or a competition, this means ahead of time. And one thing is, do not have kids out there practicing without their pre-participation physical. That is a time bomb. All school athletes and parents must have received training on concussion and head injuries that provide the school with a signed statement they've taken this training. Now, all their parents need to watch this too. Now, so I'm saying they don't require that here, but it may be a good thing. Take this video on YouTube, give it to all the parents, and let them watch it so they understand when you're making decisions out there on the field, it's not you're trying to be mean or punish their kid. You don't like people think you're following a standard of care that is required for the safety of the children. Okay, all athletes suspected of concussion will be removed from practice and not return to play until cleared. Okay, all nonprofit youth organizations using school facilities shall do the same thing also, and also written proof of insurance covering their young athletes. Return to play. The cornerstone of concussion management is returning them when proper. The recovery and outcome may be modified. The importance of considering the person as an individual cannot be overemphasized. Everyone is different. So, a stepwise progression. What's the first step of returning them to play? What do they need? Clearance, right. Okay, now you got the clearance. I said athletes should continue to proceed to the next level of symptom occurring. Each step to be taken 24 hours at a time. So here's the steps. The first one, you get them out there, you got the clearance, you get them out there, put them through running drills, through some type of stuff that you would do like in pre-season training. Get them out there running, get their heart rate up there, make them do drills, do things non-contact, and see how they function that way. If they can function that way, then that's good practice. Then the next thing is put them in basically in pads when they're running out, light contact, get them running with their pads on now and doing things like this. And if they go through that, then they can proceed to hitting, and then they have to be able to do it without any symptoms. Because if they go to the hitting part and they start getting a headache, you go back to square one. Because they can be fine that way. You know, running's fine, doing things are good. In many cases, you have two kids. You have kids that are scared, so they'll complain about everything. Then you have the kids that really want to play, and they'll minimize the symptoms. Those are the dangerous ones you got to watch out for. So basically, here are the signs and symptoms of concussion. There are signs and symptoms. Signs are loss of consciousness, amnesia, disorientation, appearing dazed, acting confused, forgetting game rules or play signs. Well, I know this is like most of your kids, right? Inability to record, score, opponent, inappropriate emotionality, poor physical coordination, imbalanced seizures, slow responses, and personality changes. The symptoms are headaches, dizziness, nausea, vomiting, difficulty balancing, vision changes, light sensitivity, that's photophobia. Phonophobia is sounds, they're holding their heads, feeling out of it, difficulty concentrating, ringing in the ears, drowsiness, sadness, hallucinations. Those are all the signs and symptoms. So basically, the thinking deficits, they can't remember things. Lack of sustained attention, you know, they can't focus on what you're talking about. Confused mental status, they don't know where they're at. Amnesia, they forget. Dazed look, vacant stare, they're out of it. And slurred or incoherent speech, vomiting or nausea. Slow motor responses, emotional liability, memory deficit, short-term delayed memory, poor coordination, and dizziness. Like I said, they don't have to have 3 out of 5, 4 out of 5. All they had to have is 1 that you suspect that they may be a problem. Headaches, restlessness, nervous weakness, or excess sensitivity to light. So, I'll sum this up very simply. Be smart. Think about the big picture here with these children. They're going to have the rest of their lives to live. It's not going to be resting on one practice or one football game. Tough as it may be, I remember those days, you know, it's really hard, but you've got to be the person making the logical decision for the long term. Err on the side of safety. You know, if they don't play and they were fine, guess what? They're going to live to play another day. You err on the side of basically being dangerous. You know, they may have a problem that not only affect the child, but it'll affect you, your league, and also you'll feel terrible beyond belief. Believe me. A return to play note from the doctor does not get you out of jail free. You get the return, that's the first step. You got to do the thing. Watch this kid. Watch this kid. Ask them how they're doing. Do a little program. Do the step return. Do the right thing. Protect yourself, the players, and the league. So, I want to thank you very much. I know it's a lot of information, but I just want to let you know that if you have any questions regarding this, you can contact me by email, special situations. You can call me on my cell phone. I left my card up here. It's got all my contact information up here. And like I said, I'm also, if you would like to, I'll give you I'm going to have this available. Probably go through Andy. I'll send it to Andy. You can put it up on the website. The link, you can send your parents to it. You can watch it. This program is going to be presented at all the clinics coming up, so all the coaches will see it. But you've seen it, so now you know what the standard is. And basically, it's this one thing that's going to protect yourself. Risk management is a very boring subject until you get sued. Then it becomes the most fascinating subject on the face of the earth when you start looking back. And if you look at what an attorney would do if there was a problem or a kid was injured, the first thing they're asked is, what are your policies and procedures for risk management? Do you have a book? Did you attend things? Did you do this? And you'll be able to say, yes, we did. Our league is committed to this. This is good PR for the kids and the players, or parents. I mean, all these leagues are popping up all over the place. I think Junior All-America holds the highest standards as far as safety and also as far as a scholar athlete, a student athlete. So I think that's a really good thing. And if you can really convey to parents that we are committed to safety, it's going to be more attractive to them. And the ones that's not attractive to, you probably don't want them in your league anyway because they're not going to follow directions. So I thank you very much for the time that you came out here today. I know you guys do a lot of other things. You have jobs. And you come out on Saturday, so I appreciate it. But if, like I say, and we also have been doing physicals for 1997. If you got your physicals already set up with someone doing it for you, that's great. If you're having trouble, contact me. We'd be more than happy to come out and do them. Have a great year. We'll see you out there at the physicals on the field. And thank you very much for this time. I appreciate it.